This is Krista Michener. Welcome to Season 2 of Made to Be Whole. Today we're going to give you an overview of what to expect this year and talk a little bit about the business and financial aspect of healthcare. Stay tuned.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
All right, welcome to Season 2, and thanks for sticking with us. I'm excited about some of the things we have planned. So far, you've just been listening to me, but we've got some really outstanding guests lined up. I'm going to give you a few little teasers about what to look forward to. So I have several pharmacists lined up to talk to us about various products that they specialize in. These are all compounding pharmacists who most of them practice nationally, so their services would be available wherever you live. A compounding pharmacy is a pharmacy that doesn't just fill retail prescriptions like your CVS, Walgreens, Rite Aid. They're able to do that, but they actually compound or make customized medications for you. So some of the ways that's useful, there are some medications that aren't available commercially at all, or they're not available commercially at the dose that your body requires. Sometimes they will be able to help people with sensitivities because we have patients who are very sensitive to fillers or inactive ingredients in medications, and they are able to compound them with ingredients that your body's able to tolerate. They're great scientists and great creative thinkers. I'm excited to hear more about what they have to offer. And because of that kind of creative and scientific expertise, they've really been great innovators in helping us to deliver healthcare in a more personalized way. We have 3 experts that have agreed to come in and talk to us about some of the services that their pharmacies specialize in. We have Randy from InfuServe America, who's going to talk to us about methylene blue. He has decades of experience with methylene blue, which has so many potential benefits. It's used in hospitals in the ICU setting as an IV in kind of life-saving dramatic situations, but it can be compounded and used at low doses for things like dementia, anxiety, depression, and then at slightly higher doses, we do use it to help with the treatment of infections like Bartonella and Lyme disease. So Randy's a wealth of knowledge. He's going to be able to share with us some truths, be able to dispel some myths that are out there, talk to you about safety. That being said, as I mentioned, topics that are coming up, if you have questions you want these guests to address, please contact us on the podcast line or email, and we will be happy to have those addressed in the episode. We have other compounding pharmacists talking about low-dose naltrexone. Naltrexone is a medication that at its approved doses is for managing alcohol withdrawal, but at much smaller doses, it is excellent at reducing inflammation and upregulating the immune system. It can help people with chronic pain where other things have failed. It's a lot more available than it used to be, but we're going to talk to the pharmacist who actually introduced me to LDN and tap his brain to learn about all the potential benefits and help you navigate locating it in your area. And then we have another compounding pharmacist who's going to talk to us about glutathione. He wrote a book about glutathione. Glutathione's the master antioxidant. So if you don't have enough glutathione, you cannot absorb other antioxidants well. So vitamin C, alpha lipoic acid, all of these things you're not going to be able to absorb well. Your liver's not going to function well without glutathione. There's a lot of amazing research on its benefits, but he has developed a transdermal glutathione, Dr. Patel has, and it has it's a really unique delivery system that has better absorption than even IV glutathione in some situations. So we will talk to him, find out more about that exciting science. We'll have an episode on hormone replacement therapy, which I've talked about in the past, but we'll go into more detail. We had a request for an episode about mold and mold illness because there is a lot of scary stuff out there and not all of it's factual. So, the Mold Pros, which is a mold testing and remediation company that I've used, they are a fantastic resource, very, very knowledgeable. They've agreed to come on and talk to us. Our physical therapist, who I've mentioned, Truly Moore, she's going to come on and talk to us about the role of physical therapy and basically using movement to re-regulate the nervous system in managing chronic pain. She's also an expert on pelvic floor therapy and pelvic floor health, so we'll tap into that. Or Leah, who is our yoga nidra expert here at the office and a health coach, is going to talk to us about the stress management benefits of yoga nidra. Yoga nidra is yoga, but it's focused on breathing. So it's something that you can do even if you really can't move. You can incorporate these principles, and breathing can be tremendously healing. It sounds silly, but breath is a big, big deal, and learning how to breathe in a way that regulates your nervous system can make a big difference. We also have a chef coming on to talk to us about how we can keep the nutrition in the food we make and his journey in finding ways to keep food delicious while incorporating this into a diabetic lifestyle. We've had a request for some case studies. So we are going to have various case studies talking about patients' journeys, with their permission, of course, in overcoming vector-borne infections, in overcoming mental health challenges, and other chronic illnesses. And we're going to have our next episode on cancer screenings and cancer treatment. So that's just a little bit of a teaser about what we're going to be talking about in 2025. But as I said, if you have specific questions that want addressed, contact the podcast line. If you have ideas for guests that we haven't mentioned or any resources, give us a shout out and we'll do our best to incorporate that in. So I'm going to talk a little bit now about the business of healthcare and the financial aspect of it. It's been on my mind for a while bringing it up, but it was motivated by a post that I recently saw in a Facebook group about a person who had recently been diagnosed with Lyme disease, and she was ranting and raving about the selfish doctors who were charging all of this excess money to help her get well and how we're all criminals and yada, yada, yada. And, cost is a very sensitive thing, especially if you are not well and don't have the ability to work like you would like to. But I want to address some of the reasons for the charges you might encounter in a healthcare setting. We, at my practice, charge an hourly rate. You obviously don't have to be seen for a whole hour, but we just base it on time, and we're very transparent with that. It's currently a rate of $400 an hour, and I'll tell you a little bit about how I came to that number. When I started this practice, we were affordable healthcare partners, and it was my vision to provide quality, low-cost healthcare for under and uninsured patients. And I have come to realize that the cost of delivering healthcare services is a lot more complex than it might appear on the surface. So I want to tell you a little bit about what our expenses are, because it's not all things that you'd be aware of. First of all, no one at my practice is getting rich. Myself and my nurses, we've all made more money working other places, and we've had health insurance at other jobs. So we're making some sacrifices on that end as we build. What you have is, out of every, say we just have the $400 an hour and I saw someone for a full hour, what needs to get paid for out of that? So there's my salary. There are my nurses' salaries, because we have to make sure that we have people who can answer calls, respond to you, be here to provide care in the office. There's the salary of the people who answer the phones and are at the front desk and check that out. So if you look at just labor alone, that eats up a big chunk of it. And when you are a business owner, you pay not just the salary, but you're also paying payroll taxes. For myself, since I'm self-employed, I have to pay double taxes. So when I'm an employee, my employer picks up part of the tax burden and I pick up another part of it. But when you're self-employed, you get kind of double hit. Labor is a big thing. Obviously, you have the cost of this building that we practice in. You have the regular stuff you would expect. You have electricity, you have your phone, your internet, water, utilities, maintenance, all of those sorts of things. But then I wanted to touch a little on the regulatory expenses, just so you're aware of some of the things that are kind of unique about a healthcare practice. And this is the reason, as I've mentioned before, that a lot of people don't go into private practice because it's pretty burdensome and it's a lot easier if that's absorbed by a big healthcare organization who has more expensive services that cover for all of their different departments. Some of those regulatory expenses are small but add up, some of them are big. One of them is I have to have a TDDD license, which is a terminal distributor of dangerous drugs, which is not nearly as exciting as it sounds, but to even do something like give you an injection or a breathing treatment in my office, I have to have this TDDD license, which is from the Board of Pharmacy. So that's something we pay for periodically. You have to have a laboratory license to be able to operate a lab, even doing things like rapid strep swabs or urine dips. You're functioning as a lab, so you have to have a CLIA license that you pay to renew periodically. You have the expense of malpractice insurance, which is based on how many people you see. So that is an added regulatory expense that's annual and it's a big chunk of money. One of our biggest expenses outside of just our physical space is the cost of having a collaborating physician. So in over half of the states in the United States, nurse practitioners do not have to have a collaborating physician. They practice independently, which is what we're trained to do. But in a big chunk of the states, you still have to have this collaborating physician, which is basically, in my opinion, just an administrative albatross. I've looked pretty closely at the hearings when it's come before the Ohio legislature before to try to remove that restriction. The one quote I will never forget, there was a physician who was in the legislature who listened to the testimony and said that basically it rubbed him the wrong way that he had to go to all of those years of medical school and that some nurse practitioner who hadn't gone to as much school could go do exactly what he was doing. It rubbed him the wrong way. Let me address that a little. First of all, we're not trying to be physicians or take the place of physicians. Nurse practitioners provide kind of a unique approach, but we are educated and trained and licensed to independently provide healthcare services. So in order to have a collaborating physician for myself and my other part-time employee, it's $1,500 a month that we have to pay. So think about that. That's $18,000 a year that goes out the door just for that cost. And the fact that we have to have a collaborating physician and that the collaborating physician has to be on my malpractice insurance also drives up the cost of my malpractice insurance. So basically, you're talking about $20,000 a year we need to bring in just for the privilege of existing. So waxing a little political here, you could say, and it's a fair assumption, well, doesn't that help your practice like run more safely? Aren't you providing better care? I think, or at least I hope, maybe that was the original intention. But if you look at how it works out in practice, it really is just an administrative position. Like the only requirements in the Ohio Nurse Practice Act are that the collaborating physician do random chart reviews. actually, I think it's twice a year, a random review of prescribing patterns, once a year, a random chart review. Certainly, a lot of them will jump in and be looking at things monthly. A lot of them do not. In some states, they have to do like 10% of the charts. Like, it varies a little from state to state, but and they are available for consultation, if you have a question. But my answer to that would be, well, what does a doctor do if there's something they don't understand? Certainly, by virtue of being a physician, it doesn't mean you never have questions or nothing's ever over your head. So you reach out to someone who's a specialist in that field, or you make a referral. We are certainly intelligent enough to know when we need to ask a question or make a referral. So it's just a huge administrative expense that really drives up your prices as consumers. We work really, really hard at my practice to keep the rates where they are. That's one of the reasons that we have introduced some of our other services, like our pain management program and our IV nutrients, other things that can provide real value to our patients, but can provide additional revenue to our practice without overextending me and helping me to keep our hourly rates where we are, because we understand it is a burden. Healthcare is expensive, but as we've mentioned on previous episodes, it's also an investment. And I really hope that as you look forward to this new year that is upon us, that you will begin to look at your health as something worth investing in, not just financially, but with your time and your energy, and not see it as a burden. Certainly, sometimes our bodies, especially as we age, seem burdensome, but really, your time and your health are your greatest assets, along with your relationships. Anything that you spend that furthers your health and your enjoyment of life, I think is time and money well spent. So if you have questions, again, about the costs of healthcare or anything along those lines, please let us know. One of the ways that we do save money, though, and I know this seems kind of backwards to some people, is by not accepting insurance. Insurance complicates the healthcare landscape. It complicates the cost of healthcare. And what happens, as I've mentioned before, people have to jack up their rates so that they can give the insurance company discounts. And I'll give you an example of two ways this has impacted patients recently. I ordered a functional stool test. This is for two different patients, that the self-pay rate is around $470, but the company will bill it to insurance first. So for both of them, the test was denied by the company, but then they got a bill for $3,000 for a test that is $470 cash. And that sort of nonsense happens because, again, insurance won't do things for you unless you're giving them discounts. So they have to jack up the prices, because if the company discounted off of the $470, they wouldn't be breaking even for their services. So they're like, okay, we have to charge this exorbitant amount, and then we will give a quote unquote discount to the insurance companies, which will cover our costs. And sometimes, even with that, insurance won't pay the full amount that they've agreed to. So, what I recommend in a situation like this is just to call and say, hey, I can't afford this. Can I pay the self-pay rates? There may still be an upcharge because of the administrative time that was spent for them to bill insurance and be denied and payment be delayed. But a lot of times companies will do that. They want to get paid too. There are sometimes self-pay discounts if you have prompt payment. So if there's something that you really don't think is going to be covered, or you check and your insurance isn't going to cover it, but it's something that you need, I recommend checking ahead to say, hey, if I pay up front, is there a discount? And frequently that will happen. We have the advantage in the area where I live. There's a large Amish and Mennonite population, most of whom do not have insurance. They're self-pay. And so the local hospitals are actually pretty good about that, because to be competitive for those communities' business, they need to have decent self-pay prices that are transparent. Sometimes you have a harder time in bigger hospital systems. I have a family member who had like just a gap in their healthcare insurance, and he wanted to take his daughter in to be seen at a regular pediatrician, but they wouldn't see her even though he was willing to pay cash like right then the full amount because he wasn't insured. So insurance, it seems like this great blessing and it should be, but it muddies the waters some too. So it's overwhelming, but I would encourage you to be educated about what your insurance will and will not cover and to develop some realistic expectations about that because I see some people be bitter and hijack their own healing because they only want to do things that their insurance will cover, or they're under the mistaken belief that if it were important, their insurance would cover it. And it's just not true. It's just not true. There are a lot of really, really valuable things that you may have to dig a little deeper into your own pocket, but it's worth it. And you can, if you have the option of like searching on the marketplace for a healthcare plan, if that's what you're doing, you can go and put in, if you're on medications, for example, you can say, okay, these are the meds I'm on and see what's covered. So we just went through and did this for my oldest son, and we were able to find a plan that the deductible was maybe $1,000 higher than the one he had had before, but they're all really high deductible plans. But most of the meds he's on were covered, and it's only a $3 copay for prescriptions. So for him, that was a huge win. So you just kind of have to look at, all right, where does most of my healthcare money go over a course of a year? Do I have a lot of medications? Do I get labs? Do I have upcoming surgeries? Do a little bit of investigation into what's covered. Don't be afraid to ask questions and don't be afraid to shop around. There are a lot of options out there. And I think that even though it's frustrating, you really have to kind of take the bull by the horns and decide that you're in charge of your health. You don't have control over the system. You don't have control over everything works, but you definitely can become a more informed consumer and you can be an advocate. I have a patient who was here this last week who's doing just tremendously, tremendously better. But part of what I attribute to that too is her attitude. You know, she had been healthy and active, got derailed by Lyme disease and Bartonella, and she just decided she was going to get well. And she had that attitude and she kept looking for answers, trying different things, looking for resources. Of course, not everyone has unlimited financial resources, but there is something of that attitude of healing, of believing you were made to be whole and willing to put in the work and keep looking for things that you can do. And if something's not within your reach now, don't just cry. Don't just bemoan the fact that you can't figure out if there is a way. Is there an alternative? Is this something you can save for? Is there somewhere else you can go for treatment? Labs are a great example. I remember getting a lab bill back and the fee for a vitamin D level was like over $300. That's ridiculous. If that's the kind of garbage that you're getting thrown, go do self-pay labs. We mentioned in another episode, you can put in self-pay labs near me, and there are a lot of labs you can order on your own, pay online, take the invoice, and get them at a fraction of the cost. Come to look at your insurance more as what you look at for your car insurance. For your car insurance, you've got it because if you're in an accident, you really need that to cover things. But you know very well that if your brakes need replaced or you need a tune-up or an oil change, that's coming out of your pocket. I've had to transition a little bit in my way of thinking about our healthcare, saying, okay, my insurance is necessary. It's there because if somebody is in an accident or gets cancer, has some catastrophic thing that requires surgery or hospitalization, we definitely want that in our back pocket, but I'm not going to put my family's healing on hold because the things we need aren't covered. I know it's a financial burden, but I really believe it's possible to find health without the full backing of the healthcare system and without having the best insurance out there. And just a little side note, you know, I have some patients who are on Medicaid and they First of all, I'm not breaking any laws by seeing Medicaid patients and not taking Medicaid. I've had people threaten to report me because they say it's illegal to charge Medicaid patients for services. No. What it's illegal to do is to be someone who is enrolled in Medicaid, but then charge more than what Medicaid reimburses. But Medicare patients are still people and they have rights. And if they want to go to someone outside of the system, they're certainly allowed to do that. So I have some patients who are Medicaid patients and they'll come in and say, oh, but I don't have great insurance. I have Medicaid. Medicaid's not the worst. It varies from state to state, but honestly, in Ohio, I have pretty good luck with most labs I want drawn. If I'm drawing, not the specialty nutrient labs, but just your regular labs, I don't have a problem with that. I have better medication coverage for my Medicaid patients than some of my private pay patients. So don't assume that you're hopeless because you don't have the Cadillac of insurance. There's a lot more out there. You just have to become an informed consumer, not be afraid to ask questions, and to not give up hope. You are maybe in an unfortunate health circumstance, but you do not have to be a victim of that circumstance. I am more and more convinced as time goes on that attitude is everything and that there are always things within your control that you can change, and the things that are outside your control, look for other options. Look for other options, but you are worth it. You are absolutely worth the money you would have spent on your coffee or your cigarettes or your trip to the basketball game or the concert. You know, maybe you'll have to give some of those things up. Some of them you probably should. But if you are worth spending money on for those things, you certainly are worth investing the money for your health, which is going to last a lot longer. So thank you for your patience as I rumbled through this overview of 2025 and my healthcare ramblings. I look forward to talking to you and introducing you to our guests. And remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.